Hi everyone, thank you for joining our virtual dental shadower session. We want to remind you that in order to get your hours, you will have to take a short quiz, and as long as you get a 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, so let's get started. We're very fortunate to have Dr. Dan for today's session. I'm handing the mic over to you. Feel free to start whenever.
Excellent. Thanks for the introduction. Well, welcome everybody. I'm up here in beautiful northern Ontario. It is almost sunset. There's boats out on the lake. It's a gorgeous evening. It's maybe hot where a lot of people are. I saw the heat wave out west, so hope everyone's staying cool. So just a little bit about myself here. So I graduated from the University of Minnesota in 2007. Dental school there was great. Actually, I really enjoyed the city. I grew up just outside of Minneapolis in a small town where my dad was a dentist and my uncle was a dentist, and I have an older brother who's a dentist as well. So it kind of ran in the family, and that's how I guess first discovered dentistry. Dental school was hard for multiple reasons, but it was also really good. I think the most enjoyable part of dental school for me, and I would highly encourage anyone that gets into school, if there is an opportunity to do a study abroad exchange in dental school, it was by far the best experience I had in school. So my second to last semester in dental school, I studied in Nijmegen in the Netherlands at St. Radboud University Hospital, and was there with all of their fifth year dental students, because dental school over in Europe is 5 years. They go right after high school. And it was amazing. I felt like I was treated like a real dentist already, and kind of had the fortunate chance to kind of like run a little bit, I guess, like do a little more procedures than I did back home. And I got to kind of pick and choose some specialty lectures and programs to be involved with. So like a complex prosthodontist where they're doing full mouth rehabilitation on all implants, which back then was kind of state of the art and new. These conus implant prostheses, complex TMJ cases, and then also spent some time in the periodontal specialty program as well. So that was kind of nice, and just so cool to be in a different environment of learning, and how the interactions with the professors and the students was different. And I'm sure that's greatly different depending on what school you go to, but I found it very refreshing. So after dental school, I moved to Hood River, Oregon, to the West Coast. I took a job at a community health center there, worked in community health for about 2 years, and then part-time for a few years after that. Excuse me. That was amazing. It was a great spot to start work. Got a lot of experience with people's complex medical histories, and then a lot of people that had like really severe dental disease, and a lot of people that didn't have the means to get help anywhere else. So you kind of felt like you were if you didn't do it, it wasn't going to happen. So was able to like push the boundaries of what you felt comfortable. And there was a good community of dentists at that clinic where you could bounce ideas off, get help in a case. And it was just like a very supportive way to start the career. And it's a salaried position, so you're not worried about producing. You're just there to take care of the patients, which I found a great value. And it felt really good to just give back to the community and help the underserved communities that are in need out. Then I moved over into private practice in Hood River, where I was there for about 13 years. And I started to work there for a guy as an associate. And that worked out well for me because I love to travel. And I traveled a lot for 13 years, took a lot of time off. I took a month off in January for probably a decade straight, and traveled for that month, 3 weeks in the Grand Canyon. So it was like this flexible situation where I could work, and then I could also take time off, and I didn't have to worry about my business faltering because I wasn't there. So I would say, go your own way, because you don't have to own your own dental practice to be successful. You can define your own success and let that kind of own it. And that was a struggle for me, because I felt like, there was like, you had to be, if you didn't own your practice, you weren't successful, is what I kind of felt like people thought in their heads when they talk to you. And I'm going to tell you that that's not the case at all. Although at this point in my career, I'm definitely ready to own a clinic, because I want that ownership, and I'm ready to stay a little more put. I did start a little contracting business where I'd go to a few different offices and do some oral surgery for them, third molars and some implants. I actually would fly back to Minnesota and got to work with my dad a little bit and my uncle. I did surgery for them. So it was nice to kind of practice side by side with my dad before he retired, and my uncle as well. And then I also do that out on the Oregon coast. And now that I'm in Ontario, I fly back to Hood River and do that for the guy on the Oregon coast and the guy in Hood River on occasion. So right now I'm on parental leave. I just had we just had a new little boy, Kai, back in November. So I'm just looking at jobs right now and looking at moving back to the Northwest and kind of starting that next chapter. So we're in the job hunt right now and trying to find something that's going to work well for us and fit our needs, and potentially buy in or buy someone out. So that's a fun little adventure. There's Kai. That was this winter. It's the sauna on the lake. There was a skate path out there that we would skate like 7 miles in the wintertime with him in his little stroller, all bundled up. It was pretty fun way to start out as a new parent. Luckily, it wasn't that cold this winter. So study tips and advice on staying motivated. So I guess a lot of you are pre-dental students. I think that pre-dental, I remember it being very hard. I remember like studying all the time. For me, it was hard to get good grades. Like I had to actually put in a lot of work and stay at the library for a very long time. And I can tell you that it's worth it, and you got to just kind of like put your head down and go for it. I think the biggest thing for me was finding groups of people to study with. Misery loves company, because some of it is kind of misery, right? Like you're maxed out, you're just constantly studying in your book. So use your resources, get a group of friends, make it fun. Don't study all the time. Like make sure you have outlets, get your exercise, join intramural sports, take trips, like do it. You need it. It's easy to do back then. You guys get time off, like spring break and Christmas, like go places, like do it, because you're never going to get that time back. So go for it. I remember in dental school studying for the board exams, we would bring our dental decks, so like these flashcards that have all these different topics on them and questions from previous dental exams, and we would quiz each other when we'd go down to go rock climbing, or we'd be out on the wakeboard boat with our dental decks, and like people would be studying in between when someone else was going. So make it fun, get a group of friends, and make the most of it, because looking back, dental school and undergrad, those are some of the best times that I can remember. Even though it was really hard and I didn't remember having that much free time, if you have good people in your life and make room for them, you're gonna succeed. Community service, so I know that was really big on trying to get into dental school. My advice there is really involve yourself in the profession, because once you start dental school, you're going to be 2 years in, and it's going to be a lot of studying, just like undergrad, and you're going to be like, what the heck? is this, like, I want to start cutting some teeth and pulling some teeth and doing some procedures. And it takes a while to get to that point. And so you got to know that you want to do it. And so make sure you talk to as many dentists as you can. Make sure people give you real world answers. It's a job just like anything else. It has its pros and its cons. I think all in all, it's a great profession and has afforded me a great lifestyle and time off, and able to, like, be here with my family, and then still be able to go find a job, which I think is awesome. There are hard things about the job too, and I'll get into that in some of these next slides, but these volunteering things I look very highly when you put in your application. So, go to the gospel missions where they're taking out teeth, work at a dental lab, get involved in this new wave of computerized scanning. So we're doing all these scans now, right? So we can scan a face, we can design 3D prosthetics ahead of time. Like, those are skills you can actually take with you later on too, and it gives you like a great foundation of knowledge, and I think would make you look like a great candidate for any dental school. So it's not just getting a 4.0. Make sure you go out there and make sure you want to be a dentist, because there's a lot of great jobs out there and a lot of great professions. Dental mission trips are amazing. I would highly recommend getting involved in those, even as a pre-dental student. You can run sterilization, you can assist, another great way to get experience. This photo is from right after, that's me, by the way, with the long hair. You probably don't believe that, but that was right after dental school. I took a month off, and that was with my buddy Eric. We went surfing down in Peru, and I brought all these toothbrushes and toothpaste from dental school that I talked them into giving me. Kind of filled my suitcase, and we went down to these little classrooms and broken Spanish, taught oral hygiene, taught these kids how to brush their teeth. And that was like one of my favorite memories of being a dentist. Like, it's that connection you make with people that don't have the means or aren't as fortunate, or don't have the education. It felt really good to help out. It's not all about making the monies. Choosing specialties, again, I would just shadow people. Shadow a periodontist, shadow an oral surgeon, shadow an orthodontist, a pedodontist. Like, it's all very, very different. Shadow general dentists. Like, I chose not to go into a specialty program, mostly because I was totally done with school. Like, I could not imagine going to more school. But if I was going to, I would have went into perio, because I really like surgery. I think dental specialties are going to be around for a long time, but I do think that general dentists are expanding their repertoire with the advent of Zoom meetings and online continuing education. You have access to so many great resources now. You can study under the world's best surgeons and not have to fly to, Hungary and study under Isabel Urban. Like, you can do that from home on your computer, and then you can watch it again. That's awesome. It used to always have to be like over the shoulder in the clinic, and so you have a lot of great resources to push your skills. Pretty much, yeah. So as a general dentist, what I really like is that I have control over the case start to finish. So if you knock out 4 of your front teeth in a mountain biking accident, you can come to me. I can take out those teeth, place the implants, and design the crowns for it. I don't have to communicate on a form what I want from the surgeon, and then have that come back to me, and then have to restore it. Like, it's all very straightforward. Granted, like, those relationships are really good and you can establish those, but I really like having the control start to finish, especially on very straightforward stuff. I think it's nice for patients to stay in their treatment home, which is their primary dentist. At the same time, I love having specialists to refer to the stuff I don't want to do, or people I don't necessarily want to see because of medical reasons, or because they're hard people to deal with. It's nice to be able to slide that somewhere else. What a typical day is like. So I didn't really know how to answer this because you'll go and watch many dentists. You know what we do? We do hygiene checks and we do procedures, and you're doing that all day, and you do a lot of it all day long, and it's busy. Move this down just so I can see. Let's see. Oops, let's go back. So, a big thing is, this is one of the negative things or the cons of being a dentist is you're working on people that are usually scared of you. That's not always the case, but there's a lot of people that come in that are scared of the dentist or not wanting to see you, or they hate you, right? I hate the dentist. They don't hate you. I have patients that love me, but they hate the dentist. But that can wear on your psyche, and I think part of dental school, the beatdown that dental school can be and undergrad is kind of toughening you up for the real world, because the days can be long and exhausting and physically tough. Like, they're hard on your neck and your shoulder, and many dentists have neck and shoulder problems, including myself. So, it's like yoga every day to maintain and keep things feeling good. But, you have the patients that love you, and it's so fun seeing, as a general dentist, seeing a kid when they're 5, and then I'm in Hood River for 13 years, and he's graduating high school. He's going to college. Like, it's crazy to be with them that whole time and see them grow as, see people grow as people, see people get married. Like, it's amazing. It's great to be involved in people's lives like that. What's the toughest part about proposing treatment plans? For me, I think the hardest part about proposing treatment plans is, and it took me a while to figure this out. And I remember in dental school having a prof or a clinical instructor who was actually a pretty bad dentist. He was like, I shouldn't say bad, he was a very average dentist, but he had great patient rapport. Patients loved him. And he could put a hockey puck in someone's mouth and they would love it. Not to say you want to put hockey pucks in people's mouths, but there's something about being able to create relationships with people and have them trust you and have like a good moral code so they know that you're doing what's best for them, and they'll love you for it. So the toughest thing about proposing treatment plans, I think, is having patients, or proposing it in a way that patients will own their disease. Meaning, it's not your problem. You didn't cause this. If they have a cavity and you fix it and now they need a root canal because it was really deep, it's not your fault. But you will get blamed for that. But instead of being upset that you're getting blamed for those things, I think it really helps to think about it. Well, why are they blaming me? How can I say things differently? Maybe you can take them on a different journey. So one of those journeys is a journey of discovery. So leading them to their disease so that they take ownership. So instead of presenting the solution to their problem, presenting their conditions, and then having them come up with potential solutions. So a lot of that's patient education. So I'll show the x-ray, I'll show the enamel and the dentin inside, and show, like what a start of a cavity looks when it's just in the enamel. And then I'll show one that goes into the dentin. That's when we have to do a filling. And then I'll point. So what does that look like? Well, that looks like a cavity. Does it look like it's through the enamel? Yeah, it does. So what do we need to do? We'll probably need to do a filling. We need to do a filling, a DO on that, or I'll show a crack. Well, you see this crack? Yeah? Or what is this? It's a crack. Well, what do you think that's going to do? I don't know. It doesn't look good. Well, what do you think it's going to do if we don't do anything? Well, it's probably going to get bigger. Well, if it gets bigger, what is it going to do? Well, I don't know. Maybe it'll break the tooth. You're right. It could break the tooth. So what do you think we should do? I don't know. It sounds like I might need a crown, doc. Put the crown on the treatment plan, right? So it's not that I'm telling them they need a crown. Their disease and condition, to help alleviate it, one of the solutions is the crown. But I'm not telling them that's what they need. If they go to the front desk and say, Dr. Madden told me I need a crown on number 30, I will be upset. I want them to go up there and have the hygienist say, Susan, hey, I have Bob here. Bob has a big crack on number 30. He really wants to take care of it before it gets worse and his tooth breaks. So we're going to schedule him for an hour for a crown with Dr. Madden. Versus Dr. Madden says that Bob needs a crown on number 30. You see the difference? So we use a lot of photos. We use a lot of digital x-rays to show and explain people's disease, to have them take ownership. And that takes time to be able to get in that flow, to be able to guide them to the answers versus telling them what they need. And some patients will force you to do it. They'll force you to tell them. But if you can guide most people, they're going to take better ownership of their disease and their problems, and you're going to get less fingers pointed at you. The other thing is finding barriers to people moving forward and acknowledging those barriers. So if Bob had that cracked tooth and he was just talking about how his daughter's getting married and he's paying for the wedding, and the chairman is like, hey, Bob, you said you have your daughter's wedding this summer, and I know you're super excited for that, and I want that to go really well for you. I know that now might not be the right time if you're putting a lot of money for that, but just so you know, I'm here for you when you're ready to move forward on that. So acknowledging his barrier and then letting him decide when it fits in his life. So there's a lot of mirroring that goes on. So if he states what's going on, just kind of saying that back to him. That's a skill that's very important. So the most important skill as a clinician is not your clinical ability, how good you prep a tooth, how fast you can do a crown or prep a filling or do surgery. It's being able to communicate to your patients. So your emotional intelligence is huge. So that's something you can start on now. There's so many books out there on that topic. You probably don't have a whole lot of time with all the studying going on, but one of my favorite books on conversations is called Crucial Conversations. And I think it's a great book for your personal relationships, your romantic relationships, your work relationships, and your patient relationships. It really teaches you a way to really listen, to give empathy, to show people that you're listening and make them feel heard. So check it out. You can get it on Amazon. It's cheap. It's like $10 or something. This is an example. I hope people are enjoying this. I don't know. It's silent. It's my first time I've ever presented on Zoom. So, for example, so recognizing a conflict, recognizing when you're in conflict, like what are your emotions? Has your breathing changed? Do you feel reactive? Have you stopped listening? These are all signs that you've been triggered into a conflict and may react and hear things differently, as you may have stopped listening completely, right? We have these little, I call them amphibian brains, our amygdalas, and once they get triggered, we go into fight or flight, right? We're just you get so focused on what you need and want to survive that you can't really listen anymore. I'm sure you've all been in a fight like that with a friend, a romantic partner, your parents. So starting on the journey to learn a little bit more about that process is very helpful and will be one of the best things that helps you out in life. So, I'll just read through this. Actually hearing what the person is trying to say. Remember, we all want to be heard. So acknowledging what the person is saying and reflect back to them their feelings they express. So it's an example from The Office, right? So Mrs. Jones calls and she's pissed. She's super upset. She got a bill for $500, and this was, she's just yelling at the front desk on the phone. And so the front desk would say, if I'm hearing you correctly, Mrs. Jones, you're upset about the bill you received for $500, and this was unexpected. Is that correct? She's like, yeah, that's right. I'm pissed. It's $500. What is this for? Blah, blah, blah. And then you acknowledge what she's saying, right? And Mrs. Jones, it can be shocking, the cost treatment, and I understand how you could be upset. you're relating to her. I understand how you could be upset versus like, well, of course it was $500. Like, that's how much a night guard is. Like, doctor has to pay for his insurance. He's paying for all his staff to keep the lights on. He has, he had to pay to go to dental school. That was super expensive. Like, we have to charge these things. Like, no one wants that, right? People just want to be heard because it was unexpected. And there's another book called Extreme Ownership that I highly recommend. It's by, what's his name? He's the military dude. I'll remember by the end of this, but it's called Extreme Ownership. But, taking ownership of, maybe something could have been communicated better during the appointment, during her exam. Maybe we missed something. It wasn't clear that that's how much it was going to be, having the system down so you have a signed treatment plan so you can show them and remind them, oh, hey, Mrs. Jones, it looks like you signed the treatment plan on, June 20th, stating that you owe $500 and that your insurance wouldn't cover it. Do you remember doing that? Cutting the games out of it and having a good system, it's a good way to cut that in the butt. Anyways, case number 1. So I made this earlier this week. I don't really remember what I put on here. So I got number 30 here. That's that lower right tooth there with the root canal. I wish I have a pointer. Can you guys see that? I don't know if you can. So the root canal here, you can see there's some lesions at the root apex. The whole thing broke off. It's decayed down to the bone. So if you have decay, here's your bone. Here's the decay. And it goes onto the front side of the tooth, the buccal. You can't really see that because this is only a 2-dimensional image. It's not really restorable. There are things you can do like crown lengthening, etc., but in this case, it's not really worth it. So we chose to do an implant there. These cases, you can either take them out, get both roots out of there and pack it full of bone and do a bone graft. That'll actually preserve that 3D volume of bone, because when you have this big empty hole and there's nothing in it, the walls of the bone with no support will tend to collapse and your ridge will get narrower. So you're gonna put a bone graft in there, or the best thing you can do is place an implant right away that'll stimulate the bone and place a bone graft around that. So that's what we did here. So when we do that, there's a little bit of interseptal bone here. I'm pointing at the screen. You realize you guys can't see that. There's some interseptal bone. That drill is going to go right into that interseptal bone through the roots. Those roots are going to help stabilize your drill. Otherwise, you're drilling into this like peaky piece of bone, and it's just your drill is just going to skip around on that, or it's going to blow through the side. So you can do it this way, or they have special burrs now called Versa burrs that can actually do bony expansion. They're really cool. This is not one of those cases, but so pilot drill through there. We widen the osteotomy, just like if you're doing woodworking, you do a pilot hole, then you slowly get bigger to about 0.5 millimeters less than your implant, and then you place your implant. So we did that, took out the roots, placed the implant, packed bone around the implant. You can see that here, little cover screw on there. This is what's called PRF. So we put a little blood draw in your median cubital fossa, pull out some blood, spin it in a centrifuge. That'll make your blood clot and separate into different layers. This is the top layer that is full of leukocytes and platelets and all sorts of good stuff that helps heal. So we make a membrane out of that, put my little healing collar through the top of it, screw it into the site, put a couple sutures in. That'll heal for 3-4 months, and then we'll put the crown on it. That's day of surgery, also day of surgery. So that's a really nice treatment that we can do in our office as a general dentist under local anesthetic. Implants are great because people will come back and they don't have pain. They think you're a magician. It's awesome. But there's not a whole lot of nerve endings in bone. There's a lot of nerve endings in soft tissue. I think I put a video. Let's see what we got. I think this is we had a tooth, a lower molar, that we took out a couple weeks ago. Yeah. Is that right?
Yes, that's right.
We took that out and we placed an immediate implant. How are you feeling today?
I'm feeling really good. It went really well. I only took one pain pill. I felt really good.
So number 19 had extensive decay with history of a root canal. You can see that there's periapical lesions on both roots. They were chronic in origin, so we were able to get those cleaned out and place the immediate implant. During the procedure, when we do an immediate implant, we will actually go through the roots with our pilot drills. We'll take a couple check shots and adjust our lengths and angulation as needed. We'll go to our final osteotomy depth and width. After we have that, we will go ahead and remove the roots, clean out the extraction site of any chronic granulation tissue, and we'll get ready to place our implant. Here we used some growth factors. We used PRF and IPRF. You can see us trimming the PRF clots here. This is APRF plus. After we get those clots trimmed, we'll put them into our tray where they'll be flattened into some PRF membranes. And you can see me placing the PRF there, and here's the membranes as they come out nice and flat. These things are incredibly strong. You'll see me manipulating them here. We're using these in a poncho technique. We'll place our healing abutment right through one of those membranes, and then we'll, in addition, we'll place a collagen membrane on the buccal where we had to bulk out that ridge a little bit because that buccal bone was extremely thin, and I was worried about it receding, so I wanted to add a little thickness there. So we laid a collagen membrane down, and then after we had that, we layered it with our PRF membrane as well, which is loaded with leukocytes, so will help prevent infection, and it's really going to help reduce the inflammation in that area and help with our regranulating of that area, as you'll see in the post-op photographs. Here you'll see our allograft that we hydrated with our IPRF, our injectable PRF. We made some steaky bone out of that. You'll be able to see that we're really able to manipulate that bone into whatever form that we want. What I love about that is it really sticks in place. We don't need to use any sort of bone putty. This works fantastic in these immediate cases and in your GBR procedures. You'll see in this video, I tried to show, I was filming and trying to retract here, showing where the membrane was and how we layered the PRF on there. If you look closely, you might be able to see it a little bit there before we got things closed up. And here it is after we got things sutured shut and our healing abutment in place. So really a nice case, really able to do this in your office and really have patients respond well with really low pain afterwards. And here's our post-op photograph 2 weeks after the surgery.
No, it was a very good experience.
That was great.
Yeah.
And we also pulled out some growth factors on you that day. Do you think that helped?
Yes, I do. I think I do. Because I really did not have much swelling at all.
That's
amazing.
awesome.
You know, like I thought I'd have a big, you couldn't notice it really at all on my cheek.
That was.
So yeah, that's pretty amazing.
With the amount of construction that went on in there.
Amazing. Yeah. No, I think they helped immensely.
Yeah. So we took out that tooth, we placed the implant, did a big graft over that area to help build that back up. 2 weeks, so we'll take a look today, see how it's healing, and then I'll see you in about 2 months.
Okay.
Oh, sorry, guys. All right. Hope you enjoyed that. So a lot of times I would do little patient testimonials after a surgery. Remember, I wasn't owning that practice. I was an associate, but I really wanted to have things that I could take with me to bring to my next job to gain some patient rapport, to validate me. It's kind of like Google reviews, I guess, right? If you're going to a restaurant, you're like, who else liked this place? So I did some videos like that, and then some educational ones just to kind of like be able to train staff and also have for patients that may have questions. So another case here. So this is a real fun case. Guy broke number 10. That's that anterior tooth there. And then also having a nice camera with a good ring flash. You can make beautiful photos, which is so fun. Anyway, so we had that broken tooth. We took that out and placed the implants. That's our pilot drill going in. And then the temporary crown that we were able to make just right there in the chair. So that's awesome. Case number 3. Let's see if I can minimize. Oh, sweet. So case number 3, this bus driver. We placed that implant there on his lower lateral. He needed to spread out over 2 years because he needed to have it covered under both insurance years. So we did a temp crown for a while. That's what formed that nice tissue there. You can see it like perfectly tooth-like. To get nice emergence, we're do digital impressions. This is with a Cerac Blue Cam. It's a couple generations old, actually. Now the Prime Scan is awesome. Love it. It makes our job easy and awesome. I love technology. I think it's only going to get better with dentistry and make our jobs more friendly for us physically, emotionally, and quicker for the patient, and just so much more convenient. So we take the scan, we design it, it's get milled out of this purple block in a soft phase, and then we polish it, put stain and glaze on it, custom stain, so we're able to like almost like watercoloring like in the office to get the custom stain. And we put it in the oven, goes to super hot and crystallizes. And then so it was a 2-piece. This is the bottom piece. This is what's called your abutment. That'll screw into the implant. And then so there's the 2 parts. The metal part with that little white portion is your abutment, and then the crown, you can see the margin there where it's not fully seated, seats onto that. So there it is in the mouth, and we did that custom stain in the office, right? So we didn't have to send that out, and you can see we got a pretty dang good color match for our bus driver. So another video, this just kind of shows what we're able to do with technology. Again, this is an older machine. This is a Cerac Blue Cam. This is 2 generations ago. I actually think it's a great machine, and it still does a great job, but a patient had some failed bonding on the anteriors, and I made a little time lapse in the office. You got to keep yourself entertained some days, right? So we'll just show that one. Kind of goes through the whole process of designing a crown and seating them. So we're prepping the teeth, getting everything going. There's the computer in the background. We'll take our digital impressions. Design it. Those will go to the milling machine. It takes about 15 minutes to mill each one. They go in the oven for 20 minutes. Bond them in. An hour later, patient usually goes out of the office for a bit, takes a break or sits in the chair, and you got a nice match there. I think this is the last case. So this guy this is after we had placed the implants and had some temporaries on there, but this guy had a work accident where he got both his front teeth knocked out there, the central and the lateral. Had a bunch of scar tissue up there. It's a really difficult graft. We had to do a pretty huge graft to get bone in that area. Anyways, so we grafted it, put some temporary crowns on there to mature the gums, and I sculpt them for what the finals would look like so I can make some final adjustments. He came in, we put our scan posts on, scanned it, designed those crowns in-house. And then he walked out with them that day. So pretty nice case there. Again, we designed those and stained them and, all in-house. And that's, for me, that's kind of fun. It's kind of like a little bit of art. And I kind of like that stuff. So, but you don't have to. You can just send this to the lab too. You can see our texturization there. And I think we had a pretty nice result for him. It's fun, I think when you have those emotional changes for patients, it's kind of fun for everybody when you feel like you did a good job and they're happy and they're out there smiling, because smile is the first thing everyone sees, right? So I guess you can change people's lives a little bit. So that is pretty much all I have. You can contact me if you have any questions. I'm happy to help you on your journey. There's my email, and then on Instagram, I'm Flossifari, or I also have another one called Wave Pilot Art, which I do a little bit of art on, but feel free to contact me, and yeah, I guess we'll go to some questions now.
Okay, so for our first question, we have, what are some dental volunteering organizations that you suggest some pre-dental to join?
Volunteer organization? So yes. That's a good question. I think it's going to be really based on your location, right? So, I mean, if you wanted to do like a mission trip, like you could literally look at any country you wanted to go to. If you wanted to go to Guatemala, Costa Rica, and look for, like, just type in Google dental mission and then reach out to them. A lot of times locally, your like local Rotary Club may be a way to get in contact with someone like that, or your local dental organization. So like you could, if you're in whatever county you're in, just look up the dental society, or contact one of your local dentists and ask them if there's a dental society, and if they do any volunteer work, or have any dental missions planned. That'd be a great way to find out, like, locally what's available for you.
So for our next question, we have, how do you find jobs as a dentist?
Good question. So a few ways. I'll tell you how I found my first job, and you'll laugh because it doesn't even exist anymore. That's what I think is hilarious. So I went on my spring break trip, my last year of dental school, and we were traveling through Oregon, and we got to the spot and we loved it. And we were both windsurfing, me and my buddy at the time. And it's like, this place is amazing. And we went to the phone book, to the yellow pages, and we called every single dentist. We just cold called every single dentist, and we ended up getting an interview at the community clinic that day. And we went and did a walkthrough. So for me, looking for my new job right now, I basically, looked at the Washington dental website, their association, their website. They have classifieds. So that's one spot. And then also the Washington Dental School also has classifieds. So you find classifieds at your state dental association, and then your dental schools. And then also, I think what's not as good, but like Glassdoor, it's just looking online for online postings. But honestly, like, I think just like, I just I find an area that I wanted to work and just contacted as many dentists as I could, even just to talk with them, just to get my name out there. Like, maybe they're not looking for somebody now, but maybe in 5 years they will, and they'll remember, oh, hey, I remember that Dan guy, he came to my office and he seemed nice. Like, I wonder if he needs a job. And I think those relationships and connections you make, they stick with you. So, try to make them. I think I had a guy that I interviewed with when I first moved to Oregon that contacted me like 7 years later, like wondering if I liked it in Hood River, if I wanted to move to Bend, and did I want a job. So, I think just getting your name out there and visiting people is the best way.
And the next question is, would you recommend owning a practice? Why or why not?
I think I'll give you both. Good to own a practice because you're your own boss. You get to set your own hours. you're going to have better tax advantages, meaning that you don't pay as much in tax, so you're going to take a little more home. Bad part is you own a dental practice. You have to be there. You can't leave. I mean, you can leave, but like if you're not open, then your business isn't open. So let's say you want to take the month off in January, well then all of your employees can't work in January. How do you manage that? It gets a little more difficult to be able to have big blocks of time off or etc. because your patients want you there, but you can also hire an associate. So there's some flexibility. Not owning a practice was nice for me at that point in my life because I wanted to travel a bunch. I didn't want to be there all the time, and I only wanted to work 3 days a week. At this point in my life now, I'm happy to work 4 or 5 days a week, 4 probably. And you know, we just had a child, so we're going to stay in one spot. Probably won't be traveling as much. So I'm at that point where I'd like to own a practice because I want that ownership and I want to create something that's my own, and I want to do it. I want to do it my own way. Whereas before, it wasn't as important to me. It was more important to be able to have the flexibility and freedom.
So the next question is, what do you think is the highest growing specialty field?
Highest ranked?
Growing.
Highest growing specialty field?
Yeah.
I think, man, that's a tough one. It depends on the area of like the country. I think the biggest demand is pedo. I think pedodontists are needed a lot of places. The other specialties, I think, you know, more general dentists are doing ortho, more general dentists are doing oral surgery, you know, but you're going to find good jobs everywhere. So it's just kind of, you know, what you want to do. That's a great question. Trying to answer it as best I can, but that's my answer.
Okay, that's great. So for the next question is, what are some CE courses that you recommend, including the hand-on CE course?
Yeah, you bet. So I think the best courses, especially early on in your career, are to establish like a continuum of learning, meaning that it's not just a weekend course. So there's courses out there that will have meetings like, you know, once a month. They're going to have, you know, your implant training. And so every month you meet with that same group of people and like you share cases and you like, you know, you get to try some stuff and then like you run into something that you had trouble with or you forgot about what they said and you can go bring it back. So those are really good. The online ones, there's so many. I think a great video one with like a lot of really good experts is Global Institute for Dental Education. Sasha Jovanovic started that. He's a dual trained prosthodontist, periodontist. He does some hands-on courses down in UCLA as well. I went to a few of those. Those are really nice. And he also has ones that are like that continuum based where it's like a master series and you meet, you know, throughout the year. Those are really good. So yeah, there's so many. There's like, there's a lot of really good CE right now. I think it's awesome for our profession.
Okay, and the next question is, isn't it hard sometimes to educate the patients on their condition? What if you as a dentist can predict something that the patient is not able to?
To predict something. So I guess maybe you're talking about prevention, like.
I think what the question is pretty much asking is like, how do you bring that to the patient themselves when they were not able to predict something that could have occurred or can occur?
So like educating something that could happen in the future? Yeah. So I think it depends on, you know, what it is, but, visual aids are super helpful. Pictures worth 1,000 words, right? So like if we're talking about like, oh, hey, you have gingivitis, and you're like, okay, what does that mean? My gums are bleeding, so what? Well, it can lead to bone loss. Having photos of what bone loss looks like and like real people's teeth. So you're like, well, this is what it looks like when it's untreated, and showing them like what happens when they skip their 6-month cleaning, taking pictures of their calculus on the back of their teeth and showing them their red gums and like flossing back there and showing the blood, like it really shows people like, oh my God, that's what it looks like, because you don't know unless you see. Going in and doing a filling and like opening the tooth up and taking an intraoral photo of it and showing them the decay, like what it looks like. Like you bet your butt people will come back once they see like, what it looks like in there. So yeah, I think lots of photos and visual aids are probably the biggest thing.
Okay, and for the next question we have, as a general dentist, can you still focus on performing select types of procedure? For example, just endo or just perio, despite not being a specialist?
Yes, you can focus on that. So like my contracting business, I just did wisdom teeth and implants. So you can focus on that. You can't market yourself as just that though. So like I couldn't hang a shingle and say, Dan Madden, practice limited to oral surgery. I don't think that exists. Well, maybe you just can't say specialist. There's different rules around like advertising, but the short answer is yes, you can. Like you can create a niche for yourself. Like I have a buddy who only saw kids. He's a general dentist. Like he only saw kids. And then eventually he went to pedo, but like when he was a general dentist, he only saw kids. But if you're like only going to see kids and that's your goal, then going into the specialty program, like now he's going to be compensated more as a pedodontist than he was as a general dentist doing just pedo, because there's a different set of codes for a specialty if you're a specialist. So you're going to be able to get reimbursed more through insurance, et cetera, and you're able to charge a little bit higher fee. So it would make more sense to go into pedo. That makes sense.
Yeah, that does. Thank you. And so for the next question we have, I know this might change depending on the location and clinic, but can you explain how insurance works? It seems so confusing.
It is. It is so confusing. Insurance is like a coupon program. So your insurance is basically you go in and I do a crown on you and you get $200 off the crown. But if you need another crown, you don't have another coupon because you already used all your coupons. It's not like medical insurance where like, you break your arm and you need to pay for the first $500 and then the rest the insurance coverage. It's not that. It's not insurance. Dental insurance is a misnomer. We should get rid of saying dental insurance. It should be dental benefit program. It's a dental benefit program. You get $200 off your prosthodontic work, your crowns. You get cleanings for $10. We could talk for hours on insurance, to be honest with you, because it's a hot topic. Basically, how insurance works for a dentist is they rope you in to be in a contract. So if my fee for a crown is $1,000, they say if I am signed up with their insurance that I can only charge the patient $800. So by being a preferred provider for, let's say, Delta, I can only charge my Delta patients $800. And the insurance company is going to pay $600 of that $800. So even though my fee is $1,000, the patient's only going to have to pay $200, and the insurance is only going to give me $600. So it gets very confusing. And the insurance benefit is usually only $1,000 a year. So, they just use $600 on that treatment, right? So insurance is very confusing. I hope we get to the point where we can all just get rid of it, because I think it's bad for everyone in the dental office. Good for medical, bad for dentists.
And for the next question we have, what is something that you wish you knew before investing time and money into dental school?
I wish, it's a good one. I think I wish I knew that it was as physically demanding as it is. Dentistry is very physically demanding. You're kind of leaning over the patient all day, and it can be very hard on your neck and your shoulders and your hands. And I didn't know that going into it. So I wish I knew that. And I wish that I knew how fast time flies. So if you have goals like owning a dental practice, make sure you stick to it and hold yourself to it, because before you know it, you'll be 10 years out and you'll be like, oh my God, I never bought that. And you could have put a lot of equity into someone else's practice that could have been your own, if that's what you wanted.
Okay, and for our last question, we have, this might sound counter-initiative, but I've heard that owning a practice right after getting out of dental school would help to pay off your debt earlier in the long run. How accurate is this information?
Good question. So basically, that's a hard question to answer. You're going to come out of dental school very slow. Like, you're not going to be able to do much dentistry. So the way that works is dental school, like in the morning, you're going to like see one patient and do like a filling, like a DO on number 12. It's a 2-surface filling. You're going to get paid $250 for that. And then in the afternoon, you're going to do another filling. So you charged out $500 for that day. You know, if you were an associate or even an owner, you'd make about 35% of that. So $500, 35% of 500, 35 times 5, right? You know, so you can do the math there. You wouldn't make a whole lot of money. So it's high risk to own your practice right out of school because you're slow. You don't have enough experience. Like, it takes a long time, probably 2 years to like get your speed up and comfortable, where owning a practice makes more sense, because then you'll, your fixed costs, paying for your rent, paying for your building, your insurances, etc., are all still there, but now you're producing more. So it's a better like business than when you're just out of school. So you could own it right away. I would say if you want to pay off your student loans the fastest, you need to be in a highly productive office. Doesn't matter if you're an associate or a dentist or an owner. But I think getting into ownership sooner than later, you would probably likely make more money, to be honest with you. But you're going to have more stress. So it's a give and take.
Okay, thank you. And that is it, folks. Thank you, Dr. Dan, for taking the time to talk to us about your profession. It is truly appreciated, and I know I learned a lot from your presentation. And to our viewers, our quiz is linked in our link tree and in the description of this video as well. The quiz will stay open for 24 hours, after which it will close and scores will be sent out. And remember, a 3 out of 5 is required to receive credit for our session. To Dr. Dan, I want to thank you again for today. Everyone, have a great rest of the day.